Good morning. It's March 25th, 2025. I'm Dr. Deuk. Our patient has SI joint pain, sacroiliac joint pain. You have two SI joints, a left and a right. She has arthritis in both, and she needs treatment for both. Take a look at the x-ray. You can see her SI joint is very sclerotic, meaning thickening and darkening of the bone around the edges of the joint. And then the joint itself is white. You can see the space there. So how do we fix this? Well, a lot of doctors will try to tell you you need to have a fusion, but fusions don't work, and I wouldn't get one done. We used to do them. They don't work. Patients' results are terrible. I wouldn't recommend an SI joint fusion ever again, and they've proven that they don't work. A study out of Norway came out last year, showed they don't work. So what's the best treatment? The best treatment is what we're doing right now for this patient. It's called a Deuk plasma rhizotomy, available only at Deuk Spine Institute. Now, what we're doing here is we're destroying the pain nerves. Sean, where are these pain nerves? Well, they wrap around bones in her back in specific areas, and we're going to go and cut those pain nerves in those specific areas. Okay? So, how do we do that? We use a special probe, and we go to where those pain nerves are, and we cut them. We destroy them. This procedure is known as a rhizotomy. And rhizotomy means to cut or destroy a nerve. Now, the nerves we're destroying are not the kind of nerves that, everybody talks about, nerves going down your leg, for example, or nerves to important structures. These are nerves whose only purpose is to transmit pain from a painful joint up to your brain. So destroying these nerves is very effective at getting rid of pain from a painful joint. All right, Henry, let's show the audience how this surgery works.
Of course.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Sean, you can see from our video that when your sacroiliac joint is injured, over time, arthritis sets in, and that arthritis causes the joint to be destroyed, basically from the arthritis, and it causes structural changes in the joint that we know are characteristic of arthritis, okay, which is the sclerosis we just showed you of the bone around the joint. You can see it on this side as well. Jordan, show us the sclerosis, or thickening of the bone around the joint. You guys see that black, dark coloration all along the joint on both sides. That is sclerosis, okay? And that's a sign of arthritis in this patient. Now, the technique I use is special that we developed here at Deuk Spine. It's my technique. I developed it. And it's called the Deuk Plasma Rhizotomy. And there's two things that are special. Well, actually, a few things special about it that make it different. Okay? First of all, rhizotomy is a treatment that doctors do to destroy pain nerves that go to a painful joint. And the destruction of those pain nerves allows the joint that's painful to become non-painful and have normal movement, normal natural movement without pain, which is what everybody's goal in life is, to have normal movement without pain. And that's what we're able to do with our Deuk Plasma Rhizotomy. But we do several things different. One is we use a special wand called the Deuk Plasma Wand. You're watching it right now working, and it's amazing. We use it for all of our treatments. Second of all, it's the technique we use, how we do the treatment. It's not the same as like an RFA for the SI joint that doesn't work. Medicare just stopped covering RFAs for the SI joint, by the way. And it's hard to get any insurance coverage for these procedures. But we perform them at Deuk Spine all the time. People do have to pay out of pocket, but it's worth it when you can get rid of that pain, which we're working on right now for this lady. Any questions?
At this moment, no current questions.
All right, we're done. So that's 2 SI joints treated. We're going to move on to the piriformis muscles next. So please join us for our Deuk piriformis release, another patented procedure, FDA approved, performed by Deuk Spine.